Good day, greetings, welcome to today's Huntington Learning Center webinar, Balancing Academics and Extracurricular Activities for Kids and Teens with ADHD. Tonight's presentation is delivered by Dr. Mary Rooney. I'm Michael Hackmer, I'll be your moderator for today's event, and on behalf of Huntington Learning Center, I want to say thank you so much for taking time out of your day. We know there's a lot going on, so we really do appreciate you making some time to join us tonight. So just to take a couple of quick moments to talk a little bit about Huntington Learning Center before I introduce our speaker. As some of you may know, we've been around since 1977, and we've really achieved a really successful long track record helping students from kindergarten through grades 12, helping them achieve academic success as well as to help them boost their confidence. Now, there are three things that I find really distinguishes Huntington from other test prep or tutoring organizations, or just going out and getting a tutor to help your kids. And those three things are this. First of all programs are taught by highly trained and certified tutors. That's really important. In fact, Huntington has a very well-recognized training program. We really want to make sure that everybody that interfaces with your child has the proper training and skills with which to help them succeed. Huntington is also accredited by Middle States Association of Colleges and Schools. And the reason why that's significant is because as your child goes through their academic journey and they look at degree and certificate programs, typically a college or university or any other kind of institution that has a degree or certificate program, they're going to be certified, or actually accredited, I should say, by Middle States Association of Colleges and Schools. So for us, it's very significant to maintain that. And the last, but I think probably the most important aspect of what we do that I think is very successful, is we use a really targeted, individualized learning approach. We get kids in, we do a full assessment. While every child might have similar challenges, either with math or English or study skills or test prep, or even struggling, as some of you have with your children with ADHD and trying to master their homework and those kinds of things. At the end of the day, every child is very unique. They're unique in how they study and their gaps in knowledge. And so we really believe that getting in, doing that assessment, getting to know your child will allow us to be more successful and deliver a personalized, individualized education program. And the results really do speak for themselves. So when you're looking at reading and math, on average, after about 3 months, we can increase the grade levels by about 2. So that's pretty significant. And then if you're looking at test prep or college test prep, on average, you're looking at an increase of 229 points for the SAT and 5.4 points for the ACT. And then, of course, there's also the aspect of scholarships, which is pretty important for a lot of families going on to higher education. So now I have the very distinct pleasure to introduce our speaker tonight, Dr. Mary Rooney. Dr. Rooney has participated in other webinars with us, and she's also done some guest blogging for us in our ADHD section on our website. So we're really thrilled. Dr. Rooney has a PhD. She is an ABPP. She's a licensed clinical psychologist, board certified in child and adolescent psychology. And of course, she's also a nationally recognized ADHD expert. Her clinical interventions and research avenues emphasize working closely with parents and teachers to create a supportive, structured home and school environment that really enables children and adolescents to reach their full potential. So we're really thrilled to have Dr. Rooney as a partner of Huntington Learning Center. And without further ado, I'm going to turn things over to her. Dr. Rooney.
Excellent. Thank you so much. And thanks everyone who's here listening today. I'm really excited to be here talking about this topic. It's a very important one that comes up a great deal in the school-based work that I've done and in the clinical work that I've done as well. And it comes up across the board for younger kids, all the way through middle school and high school. So we'll be touching on a lot of relevant topics today. So for the agenda, we're going to focus on understanding the benefits of extracurricular activities, why youth with ADHD need more support than other kids, strategies for creating and maintaining a successful balance, knowing what that might look like for your child or teen, and finding help when they are struggling or you're struggling to help them achieve balance. So as I was saying, balancing school, homework, and extracurricular activities is difficult. It's difficult for most kids and teens and families, and this starts young. And the participation can feel manageable at first, early on, but for many kids, it can quickly mushroom into a schedule that is too full, doesn't leave room for homework or downtime or family time. And so today we're going to talk about strategies with ADHD kids in mind in particular, because they struggle with this more so than kids without ADHD. So starting off with some of the benefits, and this is really important because we're going to hear a lot about the challenges and how to manage it, but I think the number one thing to keep in mind is that it is worth it, especially when you're able to strike a right balance. The benefits are vast for kids and teens with ADHD based on what we've seen in research and just based on tons and tons of clinical and school-based data. So extracurricular activities create that structure and routine that kids and teens need to function well outside of school hours. And they also encourage physical activity, which in and of itself has been shown to improve ADHD symptoms. They provide opportunities for kids with ADHD to learn and practice their social skills in more structured situations where they can be successful and are supervised by adults. And when activities take place out of school or are tied to academic performance, they can improve a teen or child's desire to be at school, even go to school in the first place, and give them a reason to work hard in their classes and on their homework. And for kids who struggle academically or socially at school, participating in extracurricular activities can give their self-confidence a real boost. And it's through these non-academic activities that they can have a chance to excel at things that they enjoy and do well at those things that come more easily to them. And they're doing it in a situation where their peers can see them being a top performer, right? Rather than one of the kids who might be struggling in class. And then for activities that aren't associated with the school, they have an opportunity to have a whole separate peer group of like-minded friends who are completely independent from any of the academic or social challenges that may have come up in the school environment. And it can be a really freeing social experience for them. And these activities can also reduce the risk of substance use and other risky behaviors that we see, unfortunately, more often in especially teens with ADHD. And they also sort of naturally put these limits around screen time. So for any parents who are really struggling with that, and most are, when you are engaged in something that doesn't involve a screen, like extracurricular activities, then you're limiting your screen time for that day. There's just less opportunity to be on screens. So participating, though, as I mentioned, can be challenging, and I'm sure everybody on this webinar call knows that. So let's talk about these very real challenges. What's harder for kids and teens with ADHD? So the struggle to be on time. I'm sure I'm preaching to the choir with this, but it can place a tremendous amount of added stress on kids, teens, and their parents. And equally as challenging is keeping track of the schedules with these activities that could change from week to week or season to season, and then keeping track of all of the gear that they need for these activities and remembering to bring it with them on the days when they need it, sometimes in the morning, and they don't even need it till the end of the day. So keeping track of all of that is a challenge for kids with organizational difficulties. And then most kids and teens have levels of motivation that fluctuate pretty frequently and dramatically, and this can impact their level of interest in participating in activities, even the ones that they enjoy. So sometimes it can be frustrating if you sign your kid up for something or they sign themselves up, and then all of a sudden 2 weeks later, they don't want to participate anymore, and then they want to drop out. But if they drop out, they might regret it. So it's this kind of like managing this other emotional and motivational challenge. And then because of their ADHD symptoms, they need extra time each night to complete their homework. And extracurricular activities can make it very hard to squeeze in even a minimum amount of homework time. So when you add those things together, it can often lead to less sleep, and then insufficient sleep can make ADHD symptoms substantially worse. And on top of that, ADHD symptoms are often worse in the evening after ADHD medication has worn off, or after kids and teens are just mentally fatigued from their day. So kids with ADHD and their parents can easily feel overwhelmed by their busy schedules, which makes kind of providing this extra support and figuring out a strategy and approach that works for you all the more important. And this kind of touches on that, and just saying really here that that support that I'm going to be talking about, I'm going to talk a lot about obviously what parents can be doing and how you can work with your kids to support them in this. But it's important to remember that it's not just at home that they need extra support. It's important to also consider what kinds of extra support you can get from the school, either from counselors or from teachers with things like workload, and helping them to understand the challenges you're facing and seeing if there's anything that can be done about homework, or even getting homework done at school if there's study halls or different periods that the school can work with you to kind of carve out some supervised homework time. And in general, the level of support should be matched to the child or teen's individual needs and developmental level, not necessarily what you think an age-based expectation might be. So it's common, as we're kind of talking about these things, for parents to have a thought go through their head that's like, but my kid is in 10th grade, they should be able to handle this by now. Why am I still having to do this? And it's because they have ADHD. And it can be hard sometimes to keep that in mind, especially when you've been at this for many years now. And so it's thinking about what is your child's individual need right now, and set your expectations to that need, and how can you support them and scaffold them to help them kind of grow and develop more skills to be able to help themselves more going forward. But as we talk about these strategies, I also think it's important to think of ADHD as a 24-hour disorder. It's something that we're talking about more clinically, this construct of a 24-hour disorder, with our patients and clients, and also in research. So we want to remember that ADHD affects kids and teens all day and all night. And when I think about night here within this context, it's really referring primarily to the need for adequate sleep for kids and teens with ADHD, because if they don't have that, they get a pretty significant exacerbation in their ADHD symptoms, especially if they're having like chronic insufficient sleep. So it's something to remember that we not only need to plan for the daytime, but we also need to plan for the nighttime. And too often ADHD treatment plans focus on treating ADHD symptoms during the school day specifically, right? Sometimes they focus on symptom management during homework time, but rarely do they really emphasize ADHD symptom management before school or in the after school and evening hours when extracurricular activities occur. And only sometimes do they, really take into consideration those sleep concerns that I mentioned. So as we're talking today, kind of use that framework, keep that in mind as we talk through these supports. So I'm going to talk about specific strategies for elementary school, middle school, and high school. But across all of these age groups, there's some general principles for balancing school and extracurricular activities that you should keep in mind. They just apply kind of across the board. So the first is to really take a step back and think about what your child's limits, your limits, and your family's limits are. And this is going to look different for every child and teen and every parent and every family. So some kids, especially some kids with ADHD, thrive with a busy schedule, especially when they're younger. I've seen this with a lot of elementary school kids where they want to sign up for this and that, and their parents feel like they're running all over with their kids, and maybe their child doesn't have enough downtime, but they really thrive on that structure, and you're not seeing any kind of negative effects. But you also have to think about your own limits, and if you're seeing negative effects for yourself, then that's equally valid, because that impacts the whole family and it impacts your child. So know ahead of time, think about what your limits are, and we'll talk about this, but part of that means setting limits ahead of time about the number of activities that you're going to allow your child to participate in at any given time. And throughout all of this, we're going to talk about how to support extracurriculars, but the one thing is to prioritize academics and sleep. And again, that will look different for every kid. And what prioritize might mean that you're setting expectations around, if it's not grades per se, it might be around not having any missed assignments, for example, right, for a quarter or for a semester, or only one missed assignment or something like that, something where there's a little leeway, but not too much. So you're prioritizing that and still communicating to your child or teen that, yes, they can participate in these things, but we can't let our academics kind of go by the wayside. And the same for sleep. So you want to think about how much sleep your child needs. what it's feasible for them to get, and how do we set limits that support getting enough sleep every night. That said, the structure that's provided by extracurriculars can in some ways help with getting homework done and with academics, because if you have just kind of unending free time for your child to do their homework, like say you're going to sit down at 6 o'clock and you're going to keep working until it's done, sometimes that will actually slow kids with ADHD down. Versus if you have a very structured block of time and defined block of time, sometimes that encourages them to work more quickly and efficiently. So you have to figure out how your child works and what works best for you, but doing it with this idea that academics and sleep are our priorities, and we're going to fit in the extracurriculars around that. And then know the why for each activity. And what I mean by this is that for each activity that your child participates in or asks to participate in, you want to think about the why, why are they participating? Because that can help you prioritize which activities to sign on to and which to skip. So if they want to do it and you ask them why, and they say, well, everybody's doing it and I'm worried if I don't do it, I won't fit in, but I don't think I'd really like it, but I just think I should do it. Or if you have a teen and they're not really interested, but I think it's going to look good on their college application. Or are they only doing it because their parents insisting that they participate? And it's an interest of the parents, but it's not as much of an interest of the teens. And there might be a legitimate reason for having them participate as a parent, that you really want them to do it. But it's a push-pull really, and a balance between the teens, what the teen wants and what you want for them as a parent. But if it's because they enjoy the activity, maybe they're not great at the activity, but they're making great friends through doing it, or it's an opportunity to be physically active, or an opportunity for them to just build on their strengths and have an area in their life where they really thrive. All of those are great reasons to maybe add something else. And then you always want to make sure there's enough room for family time, and for every family that means something different. But too often these days, extracurriculars sort of come at the expense of family time. So figuring out what that means, what enough family time is for your family, what it looks like. Is it evenings, weekends, every other weekend there's something, every weekend, whatever it looks like for your family. And then that your child or teen has at least some downtime where they can sort of unwind and kind of chill out and do whatever it is that they want. And then the other thing is to know ahead of time what the signs of overscheduling or being overwhelmed look like in your child or your teen. And this can look, or in yourself, by the way. And this can look different for everyone. And it can include things like increased anxiety, irritability, moodiness, tiredness, just emotional outbursts or anger outbursts that are becoming more frequent. In some kids, they seem kind of even, maybe just a little bit blah, and then they withdraw. And they're spending more time alone or in their room, or they're starting to show less interest in doing things, and also just kind of seeming burned out. So ahead of time, as you're thinking through how to strike this balance, make some notes for yourself about what are these signs, what should we look for, and hang on to those so that you can remind yourself if you're starting to feel overwhelmed, or you wonder if your kid is, kind of go through that list and say, wait a minute, these are the things we said we were going to look out for, and here they are. So I think we might need to pivot. All right, so let's talk about elementary school. So I think it's best to kind of think of elementary school and extracurricular activities as laying the foundation for what school and extracurricular and academic and extracurricular balance looks like. And you can sort of have these building blocks or foundation that you grow from as things start to get more challenging, as demands increase, basically, around extracurriculars and school. And when you've laid this solid foundation, it's easier to kind of continue to create this structure and this balance going forward. So what you want to do at the outset is define the minimum and maximum number of activities that you expect your child to be participating in at any given time. And I put minimum on here because it's also not uncommon for some kids with ADHD to resist participating in extracurricular activities. Some of it can be because of that motivation issue that I mentioned. Some of it can be some social anxiety. Some of it can be because they would prefer to be spending time on their screens, and it's hard to pull them away from that. But given all the benefits of extracurricular activities, I think it's a good idea to have a minimum requirement that they must participate in something. And you want to define what that is. And then, of course, the maximum, right, to avoid the overscheduling. And then when you're trying to decide which activities should your child participate in, it's obviously your child's going to express interest in things, or you hope, and then you deciding kind of helping to decide, I guess, what should the priorities be for your child when if you have to rank order things or only sign up for some of the things that they want to participate in. And then also their social needs. So maybe they really want to participate in 2 or 3 sports, but you know that in this other activity, maybe it's Boy Scouts, Girl Scouts, there's this group of kids that you really think that they would click with and that they have an opportunity to do something a little bit different that they may really do well in, then it's okay to kind of push for that and say, hey, let's try this, right? And prioritize that maybe over one of the things that your child's expressing interest in. Because at this age, when they're younger, it really is a balance of you looking and saying, okay, this is what I think my child needs, and then your child pushing for what they sort of like impulsively and in there from their child lens, like, this is what I want to do and this is what I'm interested in. And once you've like ironed all of that out and are in the thick of it, using visual daily and monthly calendars is going to be important. And depending on your child's age and their sort of how much they like reading and their reading ability, you may want to use more graphics to kind of demonstrate the different activities than words, or you can obviously use just text, but having it posted somewhere that you and your child see every day, so whether it's in the kitchen or outside of their room, to someplace that's convenient, and reviewing it regularly with them and getting them in the habit of viewing it regularly. And then when it comes to all of their gear or the things that they need, you can add that to the calendar or a daily agenda of like, this on Tuesdays, I need to bring X, Y, and Z with me. And I check this before I head out the door to make sure I have it. And keeping those things in the same spot every day in a very simple way. It can just be a bucket for this activity, a bucket for that activity, but just creating that basic structure that's simple and that with your help, they can follow, right? And then when you're making your daily schedule, which may change day to day, like might be every Tuesday's the same, but every Wednesday's the same, but not every day of the week is the same. Whatever it is, on every day, you want to schedule homework for as early in the day as possible, when they are the least amount of fatigued as possible. If your kid's a morning person and they don't have that much homework, it might be doing the homework in the morning. But if it's after school, then doing it as early in the day as possible. And then if your child takes medication for their ADHD, it's not uncommon for this medication to wear off before they're doing their homework or before they're at their extracurricular activity. And if you're seeing that happening, then I recommend talking to your child's doctor to see if there's an options that might be able to extend the amount of coverage they have for their medication over the course of the day. And as I mentioned earlier, prioritizing sleep is just as important at this age as it is when they're teenagers. And then into middle school, if you've laid that foundation, then you're working on kind of sustaining that balance that you laid the foundation for, or if you're in over your head and you want to create balance now, this will work too. But at this age, the decisions around what to participate in are a little less parent driven and should be more equal, like the child and parent kind of coming at this together, but it still shouldn't be purely child or preteen or teen driven. You still need to have that big picture view for them and set limits where needed, or give them a push if they're resisting. You see that resistance to participation really kind of hit a spike in middle school. And it's still okay to set a minimum requirement for them participating in something, but you want to do it in a way that's as collaborative as possible and maybe build in some rewards for their participation. And if you're seeing stark resistance, then I think it's a good idea to talk to the school counselor or to their own therapist and see maybe what's behind that, because there could be some social anxiety or mood stuff that needs to be addressed too. And then the simple calendar idea and the regular review should still happen in middle school. Maybe they can create the calendar with you, or if they can create it and you can just check it for accuracy. And the frequency with which you review it with them doesn't necessarily need to be as often, but it'll depend on your kid. And then again, simple organization systems. You can help your child obviously create the systems. You can prompt them to use it, make sure it's going well, and then gradually over time, try and transition it to independent use as much as possible. But if it's not going well and they're forgetting things or everything's disorganized, at this stage, stepping in and helping and modeling is still completely appropriate. And then communicate with their teachers to understand homework expectations. Let them know if there's limitations on homework time because of these important extracurriculars that they're involved in, and justify why they're important in terms of their social skill development, the need for structure, routine, physical activity, all things that tie back to ADHD and their academic performance. And also encourage your child to be assertive and advocate for themselves around this as well. And again, talk to your child if their ADHD medication isn't giving sufficient coverage in the early evening hours. And then again, schedule homework time as early in the day as possible. And then you can engage outside help whenever possible. If you need tutoring services like what's offered at Huntington, or if you just need somebody to kind of be a homework supervisor, or if you want to figure out if there's opportunities for getting homework done during the day, during study periods and study hall periods instead of in the evening. And then in high school, you're kind of carrying forward more of the same. You're staying involved, but you're trying to transfer as much responsibility to your teen as possible while still staying involved and while still providing guidance on the number of activities and on the schedule, reviewing calendars regularly, having organization systems that are simple and effective, and encouraging your teen to advocate for themselves. So it's a lot of the same as of what you see in middle school, but it's as your child is growing and developing, to the extent that they are capable of following through and doing some of these things on their own within the structure that you've helped create, you want to transfer more and more to them. But if it's not going well, then pull it back and kind of pivot and maybe transfer less, but stay involved. And again, encouraging them to advocate for themselves at school as much as possible. So how do you know if you're striking the right balance, right? How do you know if, okay, this feels kind of stressful and we're still really busy and my teen is, I can't really tell if it's too much for them or not, or if they're just moody. Like there's all sorts of questions that come up that can make you feel like you don't know. So I think this list of questions can be really helpful to sort of check yourself and your kid and see if you're hitting kind of as much of a sweet spot as you possibly can. And the first is my child completing homework and meeting expectations? And you can find this out from from the child's teacher or from Blackboard or any system that the school may be using to check for missed assignments, etc. And are they meeting academic expectations, just sort of broadly speaking, whatever the expectations are for them as an individual? Can my child get 8 or more hours of sleep a night? Like, is it even possible within the schedule? So even if they don't get that every night, especially for some older kids, where we know the amount of sleep they're getting is just dropping off, is it possible? And what can you do to encourage it to try and hit that as many times as possible in a week? Can our family spend quality time together based on the goals that you set at the outset? Does my child have time to hang out with friends? Are they enjoying the activities they're in most of the time? And you're going to see that motivational like waxing and waning, and they're going to, not enjoy it every single time, all the time. But most of the time, are they happy with what they're doing, or are they seeming burned out, or are they complaining? And are their ADHD and anxiety or mood symptoms manageable? Or are you seeing a lot of this irritability or distractibility, forgetfulness, impulsivity? Are you seeing spikes in any of that? And is that something that might be attributed to being overscheduled? And are you able to keep up with the associated parenting demands that come with all of this? And it's always going to be hard. It's not, nobody's going to be sitting around eating bonbons every evening, but I think that if you're able to feel like, okay, I can do this, I might be tired, but I can do this, that's good. If you're finding yourself irritable, anxious, not enjoying your kids, not enjoying your own time, I think that's a time to check in with yourself and say, is this too much right now? And if your child is overscheduled, if the answer to those questions is yes, then an activity will probably have to go. Maybe they just can't do it all. And for some kids, that might mean that they can't do 2 activities, they can only do 1. For another kid, it might be they can't do 4, they can only do 3. There's going to be a lot of variability in that. But the point is just that it might just literally be too much. But before you do that, you want to first make sure that overscheduling is the problem and not something else, like a course load, that's just unreasonable for them or too much for them. And this is something that particularly in high school comes up often, where maybe the academic demands are just too much, and kind of the cost, you hit a point of diminishing returns. They've signed up for so much academically, but they don't really need to be doing that much to kind of still meet their end goals. And it makes more sense to keep them involved in the benefits they're getting from some of these extracurriculars. Do they have enough academic support, right? For what they need to be doing? Do they need extra help outside of school? Do they have enough support around homework time? Do they have enough support in school, right? Are they getting everything that they need to be able to keep up academically? Is excessive screen time something that's cutting into this? Like, are they not getting 8 hours of sleep? But if they cut out screen time and weren't on their phones in the evening, then they would be able to. So that's something to consider. Is it the extracurricular activity that needs to go, or is it something else like screen time, whether it's video games, YouTube, social media, whatever, that needs to be limited instead? Or is it their ADHD treatment plan? Is it not effective for them right now? Maybe it worked in the past, but right now, whatever you have going on between medication and behavioral strategies, maybe they need to be tweaked to be able to meet the needs of your child currently. Or are there actual problems with mood or anxiety clinically that are maybe being exacerbated by life, meaning extracurriculars in school? But even if you pulled back on some of those activities, those underlying mood or anxiety problems would still be there. And so if it's any of those other things, you want to address those issues because they'll still be there, even if you pull back on an activity. Which points to asking for help when you need it. And this is kind of where we'll wrap up for today, but it's maybe the most important point that I could make today, which is that it's hard to do all this for your kids. It's hard for you to do, as parents, to do all of this. And you may need help from other people. And this might be coaches or club leaders or activity leaders, to have them help your child, both in terms of how they're doing during the extracurricular activity, if you need some leeway with getting there 10 minutes later than everybody else because their ADHD makes it hard, if you need some support around the gear and equipment that they need, if they can keep a backup set, with their coach, some things like that, little things like that can go a long way when it comes to like logistics, right? School counselors and teachers can be a great resource. If you explain the goals that you have for your kid with the extracurriculars, and it's very intentional, and there's a way that this kind of also supports their social emotional development and academics at school, and there's ways they can help with managing the homework load, then that's something to talk to them about. And you may be surprised sometimes at how receptive they can be. And this is maybe surprising, but I've actually seen this happen a handful of times where students with an IEP, which is designed to support academics and learning, has had some goals added to support their participation in extracurricular activities. So if you can make the case that this will help with things like time management or ADHD symptom management, social skills, other things that are kind of like goals in their IEP in the first place, then you can initiate a discussion about how to adjust the academic workload or set clear priorities, or basically ensure that your child or teen's needs and their own goals are considered in the IEP. And you may have some receptivity to that can then like push through some adjusted expectations around like the quantity of homework, for example, that a child needs, and cutting down on some of that repetitive stuff that might come home in terms of homework assignments. And then of course, scheduling out that homework time, carving out time for things like tutoring, scheduling those things so they become part of the schedule and part of the routine, just like the extracurriculars. And that's where private services like the services offered at Huntington around tutoring can be really helpful, because it becomes a non-negotiable. You have that time scheduled, your child does that academic work during that time, and then they move on. And that's sometimes where you get the biggest gains in kids with ADHD, especially when there's small group or one-on-one attention, like what they have at Huntington Learning Centers. And then your child's ADHD therapists and doctors are, of course, great resources. So around things like medication management, concerns about mood and anxiety symptoms. And if you feel like screen time limits are a problem for your child or a problem for your family, then talking to a therapist about that can be really helpful, and they can give some great strategies. So I'll stop there. It's a lot of information that I downloaded in about 30 minutes, but hopefully some of it's been helpful, and I'd be happy to take questions if anyone has them.
Excellent. We do have quite a few questions that have come in. So please use your GoToWebinar control panel and just submit those questions, and we'll take questions for the next 10 or so minutes, and then I'll ask Dr. Rooney to kind of provide a couple of key takeaways. So first question, Dr. Rooney, you talked a little bit about communication with the school at one point. This question is, how often do I need to communicate with my child's school to check on their progress? Should I reach out more than once a week to make sure everything is okay? And I imagine that might be different depending upon whether or not they're in elementary, middle school, or high school, or maybe it doesn't matter. I don't know. What do you think?
Yeah, so it's going to vary more based on the individual student, right? And also based on their age and grade. But there's two things. I mean, if the school is using something like Blackboard or another like electronic system where you can log in and check, then you can see their progress without having to check in with the school. But if you're seeing concerning things, then I think reaching out to the teacher, I wouldn't do it more than once a week, but once a week at most, maybe once every couple of weeks, if you're seeing concerning trends and things aren't improving, to find out what's going on and what they're seeing in the classroom and what kind of support might be needed, and if overscheduling is a problem or if they seem exhausted during the day. And then for younger kids, you can kind of set up, I always recommend parents set up kind of like a regular communication schedule with the teacher. So talk to the teacher, like what makes sense to them in terms of regular communication, what feels right for you in terms of regular communication, and what will that look like, and how often will it happen?
Excellent. So we got a couple of questions, very similar topics. What are some resources or steps parents can take to better help a child with ADHD? And then this question, it was on my screen and then it just popped away. Hold on a second. Are there support systems or groups for parents with ADHD kids? So people are just looking for help, resources. What are some resources that can better help a parent who's dealing with who has a child with ADHD?
Yeah, so there's a national organization called CHADD. It's like Children and Adults with ADHD. I think you just go to chadd.org. And they actually have local chapters that have support groups and like parent-to-parent groups. So parents of kids and teens with ADHD who have like received some training in some ADHD interventions and parent supports, they moderate different groups. And it's a really great place to connect with other parents. And parents that I know that have participated in some of these groups have found it almost to be like a lifesaver for them. I've had parents come back to me and like say to me, I finally found my people. Like they understand me, they understand what I'm going through, and it can make a huge difference. So I think that's the best place to start.
Excellent. You talked a little bit about screen time, and a couple of parents have chimed in with questions about screen time. Specifically, what are your recommendations for the amount of screen time? I guess, how do you know it's too excessive?
Yeah, that's a good question, because there's so much variability. And, you know, the American Academy of Pediatrics has these age-based guidelines around screen time. You can look them up if you just do a Google search for American Academy of Pediatrics, screen time limits, it'll come up. But I actually think it should just be much more individualized to the child. And in some ways, the limits might not be, for older kids anyway, middle school and teens, not so much around the amount of screen time as it is the time when the screens are no longer accessible. So I think some of the most problematic screen use happens when it interferes with sleep, and it happens later in the day, in the evening, and when they should be going to bed. And it's saying there's no screens or phones allowed after whatever time it is that makes sense for your family and depending on the bedtime. And it goes away, like it gets locked in your bedroom. You can cut off access, depending on what kinds of monitoring apps and things you have installed on the phone. You can cut off Wi-Fi, although if they still sell it, they can still get through. But figuring out how to set limits more around that, like the times of day when it's not allowed, I think for older kids is more important. And then limiting what they can access. So what are some of the things that cause problems for them, or that they are more risky? Snapchat is something that I see a lot of kids getting into trouble with. So figuring out maybe you need to limit the kinds of things they're getting into. And then the other thing, and this is especially true for younger kids, is that seeing how your child responds when it's time to stop the screen time. So when you enforce a limit, how do they respond? And so what I often hear from parents is like, well, I tried to enforce my limits and my kids freaked out. Like they melted down, they tantrumed, it was terrible, it happens every time, so I let it keep going because it's so distressing to them. And what I really see that as a sign of is that they can't handle it. It's too much for them. It's causing them to be emotionally dysregulated. So whether it's the content, some kids, it's just YouTube, they get so sucked in on the YouTube videos and pulled into the algorithm that they can't disconnect without a meltdown. And that's a sign that they cognitively and emotionally can't handle it. It's too much for them. So it's really reading your child's cues. But I personally am a proponent for as minimal amount of screen time as possible, and kind of, but working within the constraints of we live in a screen-based society. So figuring out what works for your family. But on Facebook, there's a really great group. I think it's called Parents Who Tech. And in there, you'll see a lot of other parents who are grappling with this question and the kinds of things that they're dealing with. And some parents have great ideas around what to do or what to look out for in terms of apps and games and things like that. So you might want to check that group out.
Great, thank you. A couple of parents have asked about video games, and I think this sort of is a natural extension of the screen time conversation a little bit, because kids love to play video games, and I think a couple of parents have expressed concern that they do so much of their homework on computers now, but then I find they're just switching between homework time and video games, and other kids are just constantly playing video games. So how can parents help regulate that a little bit better? I know you gave a couple of suggestions about screen time, but is there any suggestions about the video games in particular? I think a couple of parents wondered, are they more addictive to kids who have ADHD? That was one of the questions that came in. So curious if you have some other suggestions for that.
So I think in terms of the video games and limits, the hard thing with the video games, I think, is that it feels extra compelling to allow them to do it because they're social on it, right? They're not playing alone, they're playing with their friends, right? And it feels like you're cutting them off from their social circle when you cut them off from their video games, right? But the same things apply. If it feels like it's too much, or if they're dysregulated and go into a complete panic when you say that they can't play their video games, whatever games those are, that's a sign that it's not really working for them, right? Or if they're playing video games at the expense, what's the opportunity cost is how we think about it. If they're doing that all the time, what are they not doing that would be good for them, right? And are they not sleeping as well because of all the blue light? Are they not getting enough physical activity because they're sitting so much? Are they not practicing their social skills in real world settings because they're on their video games so much? What is it that's lost? And I think that often a case is to be made. There's a case to be made that there's a lot that's lost. And so that's a case for setting the limits. Now, setting the limits is hard, but doable. And I think if you look up that Parents Who Tech, I think Facebook page, you'll see a lot of this in there as well. But setting the limits is hard, but that's where the extracurriculars can be really helpful. Because if they are busy doing things that don't involve screens, then you don't have to set a limit during that time. And suddenly the amount of time available to be playing video games shrinks every day. So the limits are more easily set in a very natural way. And then if you have this rule in your house around we are not on screens, whether it's video games, phones, tablets, whatever, after a certain time in the evening, then that's also another limit that's set. So again, you've kind of shrunk that time when it's available down to nothing. And they will freak out and panic if they're used to a lot of screen time, but that will get better over time. And when they're an adult, they'll look back and thank you for setting the limits. So
Great. A couple of questions about homework. One relates to using the internet for homework, and then and the second one, maybe we'll start with this one first. How much time is too much time for homework? This parent's concerned that teachers have, I guess, a standard amount of time to complete assignments or to work on things. But for a kid with ADHD, should they be approaching homework differently, and how much time do you think on average they should be spending when compared to what a standard homework time set by a teacher is?
Yeah, so if the teacher has an expectation for how much time kids should be spending on homework each evening, I guess there's two different ways to think about it, right? So one is that the student with ADHD needs to complete the same amount of work, but it's going to take them longer. If it takes them more than I guess 50% more of the time, right? So I don't know how long the homework time set would be, but let's say it's an older kid, gets an hour. So ADHD an hour and a half, let's say, right? Beyond that, I think you're dragging into territory that's making the whole situation punishing, and they're not getting what they would need to get out of it anyway. The other approach is that there's a set amount of homework time. Because they have ADHD, it takes them longer, so therefore their workload should be less. So they still are just doing 1 hour of homework every night. For younger kids, obviously it'll be less, but whatever it's set to, that's how much they're doing too. They shouldn't be punished and have to do more time every night because they have ADHD, right? And if they could do it more quickly, they would. And there's things you can do to help them do it more quickly, but still, if it's exceeding 1 hour or whatever the set amount of time is regularly, then that's the time to talk to the teacher. And if there's things in there that are repetitive, right? So using a super simple example, if it's like a page of addition problems and all the kids are supposed to do 2 pages of addition problems, then it's not unreasonable to request that your child has to do only 1 page instead of 2 pages, because that 1 page will take them the same amount of time that it would take a kid without ADHD to do 2. And the added benefit from doing the extra page is minimal. So those are the kinds of accommodations we see for homework with kids with ADHD.
Great. Let's take at least one more, and then see if we can't, and then if you can provide a couple of key takeaways, because I know there's a lot of material. So just a couple of good highlights for parents to take. And this touched on something that you've mentioned a little bit about, what if your child is already overscheduled? I think you talked about ADHD treatment plan. So if it's no longer effective, how do parents know that? What's a good way to determine whether or not a treatment plan is no longer effective? And how often should parents maybe be examining their treatment plans, for their child?
Mm-hmm. So I think about every 6 months, I think, really to kind of check in with your provider, and they can give you a symptom checklist that's standardized and normed, and they can look for themselves like 6 months to 6 months, look back the last 6 months. Are things worse than they were, on this rating scale, or are they the same? Sometimes that's the best way to see, because you're asking the same questions every time, or sometimes they're a bit adjusted for age, but in seeing, is there change since the last time I filled this out? Because sometimes you're not even aware of how much harder things have gotten, because it's like a slow, gradual shift. So that's something to consider. And then, but just for yourself as a parent, looking and seeing, are they able to do the things that they need to be doing right now reasonably well? Are they able to get started on things they need to get started on? Are they able to follow through on things that they're supposed to be following through on? Am I having to do everything for them and prompt them every step along the way now? And it's just too much. Something's not working. And if it's an ADHD medication that's part of the treatment plan, as kids grow and change, both in terms of their height and weight, and then just cognitively, and brain-based changes, doses of medication may need to increase over time, or maybe a medication that worked well previously for symptom management is now not as effective and you need to try a different medication. So checking in on that stuff about every 6 months, or if things are just feeling really hard all of a sudden in a way that they weren't before, then considering whether what was working before for ADHD kind of symptom management is just not working anymore.
Okay, great. Now, if you don't mind, what are some, you presented a lot of really great information, and we did get a couple of really technical questions that we'll have you respond to offline, if that's all right, Dr. Rooney. And just for the folks that have asked, I know there are a few of you joined a little bit late. We are recording today's event. We're going to make it available on demand for everyone, and you can see the link on your screen, huntingtonhelps.com/webinars. If you don't see that email, just visit that particular page or go to huntingtonhelps.com. And also, I wanted to mention too, before we get to your key takeaways, you've also done some blogging on the Huntington Helps website and the ADHD channel. I didn't know if you wanted to touch on that a little bit too. I know you do a lot of writing. You have something coming up, I think, or?
Yeah, definitely. Yeah, so there'll be a blog post following this webinar that'll be coming out in the next couple of weeks. And you can check that out for a summary of some of the key points and suggestions, touching a bit more on the screen time piece as well in that post. And then in other posts that I got up there, it talks a lot about some of these things around like homework time, how to make that more manageable, and strategies for helping kids with ADHD, be more efficient about that. And just some really like practical strategies, things that parents can do, how to talk to teachers, how to communicate with your child's teacher, what that looks like. All of those things are in there. So you can search by keyword and get some answers and strategies that can go a little deeper than I can go in this amount of time for some of those topics.
Excellent. So what are a couple of key takeaways for folks that have given a lot of information? What are some key takeaways for them tonight?
Yeah, so I think the number one takeaway is two top takeaways I would say are, number one, extracurriculars really are so beneficial for kids with ADHD. And despite how hard it can feel to keep them involved and all of the work that parents have to do to support them, the benefits really do matter. And so everything that you can do to sort of create a system that works to create balance for your child or teen is worth the effort, as long as it can be reasonably manageable for you and your child. And then relatedly, I think just asking for help when you need it. It's hard for parents without ADHD in the family to do this all alone. And when you have ADHD in the family, it really is that much harder. You're not imagining it. It is that much harder. So asking for help, not being afraid to ask for help, and really being thoughtful about what kind of help might be helpful. And what are some even little things you can sort of ask for help with, and engaging the school too, and then private services whenever possible around some of the academics. And also just to really keep an eye on how can you create like sustainable systems around scheduling, organization, time management, that you can start early with your child, you can model it for them, help them with it, and then gradually, as they get older and more skilled, start to transfer some of that responsibility. And all of this effort then like kind of pays out in dividends, because it's not just their involvement in extracurricular activities and the balance you're helping to create, but you're also teaching them these like life skills around how to manage a schedule, how to stay organized, right? And how to be planful, and build confidence that they can do this on their own. So they're going to carry all of that forward with them, in addition to all the benefits they're getting from the extracurriculars. So I think, investing all of that time and energy up front will pay off in the end.
Excellent. Dr. Rooney, thank you so much. Lots of great information. We really appreciate you taking the time tonight.
Thank you for having me.
Excellent. And for everyone else, this concludes today's presentation. As I mentioned, we've been recording this event. We're going to make this available in the next day or two. We'll send an email out to you. If you don't see it in your inbox, do go back to huntingtonhelps.com, look at the webinars, and the on-demand replay will be there as well. We also encourage you to check out that resources section that we talked about a little moment ago, with the ADHD section in particular. Dr. Rooney's got a blog coming out in the next couple of weeks, but she's also got some other resources, and there are some other great pieces of information in there that can help you with your day-to-day. On behalf of Huntington Learning Center and Dr. Rooney, I want to say thank you again for making the time to join us. We really appreciate it. This concludes today's presentation. We look forward to seeing you at our next event. Stay well, everybody.